I'm happy to present the results of a clinical trial which used sorafenib, a multikinase inhibitor, in combination with standard chemotherapy in adults with acute myeloid leukemia. I present these results on behalf of the investigators of the Study Alliance Leukemia study group and the senior investigator, Professor Gerhard Eninger, who is in the room today too. So sorafenib is a multikinase inhibitor that blocks various pathways in the cells potentially involved in the development and progression of acute myeloid leukemia, and could therefore be an efficacious drug to treat patients with acute myeloid leukemia. As you can see, there is evidence for clinical efficacy of the drug, which stems from more than 30 reports. But as you can see, most of these publications are from case series or from either few clinical trials are either early phase or they are non-randomized. There is one exception. Our study group did a randomized trial in elderly patients with sorafenib, and the outcome of this trial was that the addition of sorafenib to standard chemotherapy had no beneficial anti-leukemic effect, but what was associated with a significant morbidity. Thank you. Since the biology of AML in younger patients is supposed to be different and the tolerability of an additional drug should be better in younger patients, we decided to set up a very similar trial. That's the design of the trial. Let me guide you through it. After AML initial diagnosis, patients were randomized to receive 2 cycles of induction chemotherapy with an anthracycline and cytarabine, plus either sorafenib or placebo. Once in a complete remission, intermediate risk patients with a family donor and high risk patients with a matched donor were transplanted, whereas all other patients proceeded to high dose cytarabine-based consolidation treatment plus sorafenib or placebo, followed by 1 year of maintenance treatment. These are the main inclusion and exclusion criteria, and I'm just going to focus on newly diagnosed AML and patients aged 18 to 60 years. All the other inclusion and exclusion criteria are common within clinical trials and with AML. The trial recruited between 2009 and 2011, and a total of 276 patients received at least 1 dose of study medication, therefore forming the so-called full statistical analysis set. That's the result of the primary endpoint of the trial, event-free survival. An event was either primary treatment failure or a relapse or death, whichever occurred first. And as you can see that after a median follow-up of 3 years, we see a significant prolongation of event-free survival in the sorafenib arm, with a median event-free survival of 21 months compared with 9 months in the placebo group. The p-value is highly statistically significant with 0.013. If you look at relapse-free survival, an important secondary endpoint, we can see a similar pattern with a prolongation and 56% of patients being relapse-free and alive after 3 years compared with 38%. The p-value was 0.017. Interestingly, at this point of time, we can see no clear overall survival benefit for the patients treated in the sorafenib arm. To sum up the results, we could show that sorafenib plus chemotherapy is a feasible treatment for younger patients. It produces a significant and relevant prolongation of event-free survival and overall survival, but had no overall survival benefit at this point of time. I haven't shown you the toxicity data, but I can summarize that sorafenib increases the risk for fever, diarrhea, bleeding events, liver toxicity, hand-foot syndrome, and rash in these patients. And the reasons for a potential or an efficacy of sorafenib in this mainly FLT3 ITD negative patient population must remain speculative. We can speculate that the inhibition of other kinases apart from FLT3 might be responsible for the efficacy of this drug in this patient population. Last but not least, our conclusions. we conclude that first, these data provide a high level of evidence for the efficacy of sorafenib in younger AML patients. Second, and most importantly, and this might be the reason why this talk is in the plenary session, these data constitute the first randomized evidence that actually kinase inhibitors work in AML. And last but not least, what we judge is that according to evidence-based medicine principles, a confirmatory trial would be desirable in order to establish sorafenib in AML treatment. Thank you very much.